Okay, so thank you for that very nice introduction. Not even my mother would introduce me that way, so that's very good. And I will just move forward to my competing interests. I have a few. None of them are financial. I wish I had some financial, and that would make my job a little bit easier, but I don't. What I want to try to do is spread my talk into 4 parts. Some brief remarks about the Quest Center, some remarks about publication practices, and most of it, as Uli mentioned, is from the clinical area, but anything that I say equally applies to the preclinical world. The preclinical researchers shouldn't think they're separate and unique. They exhibit the similar problems across the board, so you should feel part of the crowd. Also, I will talk a little bit about how we might improve behaviors. I'm really not a psychoanalyst. I'm not an analyst of any type. I'm very interested in changing behavior, and I think changing behavior is something that we can do. And we probably have experience in changing our behaviors in daily life. And then I'll end with some thoughts about where I think Quest could go. So first is, this is my only German, but congratulations. I think it's really unique that you have started this center, and congratulations to those here who have supported this, to Uli, who will have to take the leadership and make it happen. I should say that not everybody is always interested to hear that things aren't well. There are problems, and that's part of what we have to do. We have to move forward. And I think the center will be an important center to watch. It'll be a very important center to collaborate with, and perhaps given the spectrum and span of what it wants to do, perhaps unique in Germany, and there are certainly very few of these centers in the world. I should also indicate that I was asked formally to review the application for the center, and I can't actually remember what I wrote, but it's wonderful to see that it's a reality, and it's wonderful to see that it has intellectual and fiscal ability to move forward, because you need both. It's very frustrating to have the intellectual and not to have the money, and it's problematic to have money and you don't know what to do with it. So what do we know about publication practices? And I will tell you, this is my other part of my life, is I do quite a lot of systematic reviews. And one of my sort of hats that I wear is I'm a principal investigator for an evidence center, review center. What we do is we supply the Canadian Task Force on preventive health care with systematic reviews to develop their guidelines. And here's an example of something that I saw sitting with the task force a few weeks ago. If we look at breast cancer, which is obviously a very important issue, we are looking at always seeing low quality evidence. I could replace breast cancer with esophageal cancer. I could replace it with prostate cancer. I could replace it with anything. And almost always, we are looking at low quality of evidence to make recommendations. And I'm sort of wondering, why is that? It's sort of really strange that we are running into this problem. And I think the LANCET series about sort of waste in research, I think is an important series for a number of reasons, because it really asks the questions from, are we asking the right questions, or what's our methodology like, what about the accessibility of data, and what about the published data? It doesn't matter if it's clinical or preclinical. And I think the editors really said this quite nicely. Perhaps we could use this forensically to think more deeply about how to improve the situation. So we also looked quite recently at almost 2,000 articles published in a sense, fake journals. And what we found is interesting. These are being published For example, people at Harvard publish here, at the Mayo Clinic. I'm sure people in Germany publish in these fake journals, and perhaps even the Berlin Institute of Health. So this is a problem that really goes across the board, and we have to understand why is it happening and how can we make it better. And a colleague of mine recently gave a talk in Oxford that this has been going on for a century. And I'm saying to myself, why are we allowing this to go on for a century? Isn't that problematic? Do we not have any levers to change its behavior? And who has the levers to change behavior? So I think we could all agree that it's a very bad, what we would call in North America an ROI, which is a return on investment. It's not good for funders, it's not good for taxpayers, and it's certainly not good for patients. And it's probably not good for mice. It's probably not good for anybody in the research domain. And so what we really need to realize is a few very fundamental points. One is that all of this research has passed peer review and editorial approval. This didn't mysteriously, by a saucer, end up in a journal. It passed through a filter system, and that filter system has still published it, so it's a failure of the filter system. Not only that, but all of us in this room perhaps have been promoted, tenured, rewarded for this work. How can we reward people for publishing work that is suboptimal? Why would we do that? What is wrong with the system? And it's really not good scientific behavior, and I would argue it is definitely not good ethical behavior. So we need to think about how to improve that. And one of those thoughts that I've been having is thinking about the levers. Who are the levers? Who has the levers? Well, one could argue that journals have the levers. So here's a paper that was recently published, I think this week, in Heart, looking at the top impact journals in cardiovascular medicine. And it's a very disappointing series of results. Essentially, journal editors don't insist upon trial registration. Journal editors really don't use reporting guidelines. So what do journal editors do? And are they the people we should go to? And I think I would argue that actually we perhaps should have, with the exception perhaps of half a dozen journals in the world, we really ought to forget about journals because they're not doing their job. And it's been repeatedly showed. So we need to look elsewhere in terms of levers. And David Brooks, who's a wonderful, although he's a conservative commentator for the New York Times, he really asks an important question about, do we want to be remembered for our resume virtues or our eulogy virtues? How do we want to be remembered? By simply the number of papers we have in our CV, or by some material positive contributions that we've made to science? Other levers of power are funders. Certainly my colleague Ian Chalmers and Paul Glasio believe that funders are fundamentally important, that they are the real people with the power because they give the money. And I don't disagree with them, but I think their power is much more limiting. In Canada, the Canadian Institutes of Health Research, they fund about 14% of people. So funders don't have influence over most people because they reject most people. I think in Germany, this is perhaps in some funders, this is the range of funding. Suffice to say that funders don't fund 100% of grantees, and so their influence is, I think, much, much smaller than we care to believe. But I think academic institutions are hugely important because not only do they have the current leaders, but more importantly, they have the future generations of scientists. And we also need to think about patients and public. We need to bring patients and the public into what we do, because I think if they understood what we do, they would be very, very disappointed with us. Now, there are people, Alistair, Yuli, Glenn Begley produced a nice paper indicating that actually academic institutions are really not doing as much as they should be doing, and I believe that to be very much the case. And I don't know if Frank Medema is here, but he is Dean at Utrecht, and also wrote in The Guardian that actually we need to really rethink perhaps how we are promoting and rewarding people for what they do, because I hope that I've been able to convince at least a handful of you tonight that even the few slides that I put up would indicate that we are not doing a good job. We need to do much, much better. And so what I'm interested in doing in the next series of slides is talking about improving behavior of scientists. And I have started to write about this, and many, many others far more brilliant than I am have been writing about this as well. And we may be at an important sea change in terms of actually trying to change the culture in academic institutions where we actually have leverage, where we can perhaps control and influence current scientists, but more importantly, the future generations of scientists. So my interest is actually on the research component. I know that for promotion and tenure, there's issues around administrative functions, there's issues around teaching. My interest is purely around the research component of that. So many people and many universities have this notion of publish or perish, and publish or perish with the highest journal impact factor. And even in some countries, for example, in China, if you publish in Nature or Science, you might get a reward of $30,000 to $40,000. So there's a tremendous drive to publish. And so for me, it must mean that promotion and tenure committees, they must have evidence. Actually, this is a wonderful metric to use. And what do we really know about the journal impact factor? And I'm not going to spend too much time here with that. I wanted to really just say one thing. I'm unaware of any body of evidence that actually shows a strong relationship between journal impact factor and quality. You may be able to bring me a study, but I'm talking about a body of evidence, because body of evidence is what will move us forward. So, I would say that there's really little evidence in terms of promotion and tenure. There's little evidence to inform a discussion. We don't really know what the current criteria are. I can say, at least in North America, there's no place that I can go to get a curated and annotated list of promotion and tenure across a number of universities. And why is that? In an evidence-based milieu of clinical medicine, at least, why can we not get this information easily? Wouldn't it be good to see if certain universities are doing well, what are they doing so other universities could learn from that? Why can't we get it? And I would say that we could safely say that the current criteria for promotion and tenure do not work, because I've shown you some slides of the immense problems that we have. Again, these apply to clinical and preclinical. And there are initiatives such as the San Francisco Declaration of Research Assessment that very explicitly say, do not use journal impact factor to assess individual scientists for promotion or tenure or for hiring. Interestingly enough, no Canadian university has signed DORA yet. And I will come back to that perhaps to think about what BIH could consider doing. So what I'm going to talk about is some evidence-based incentives and rewards for hiring, promotion, and tenure. And what I think is we could think about just a few things that might move us forward. And some of these are reflected in the problems that we have in the literature. Register all protocols. Doesn't matter if they're clinical or preclinical. We want to stop switching primary outcomes covertly. We want to share data. We want to promote reproducibility. So I'm going to mention Ben Goldacre a number of times, and he developed Trial Tracker. And while there were some initial problems with Trial Tracker in terms of how it gathered data, conceptually it's incredibly important. And what Trial Tracker can do, it can actually look and see whether you are reporting results that you have registered. And what you could think about is, how well are you doing at BIH? How well is the hospital doing? You could think about this. Here is a group from Yale that actually went and looked across the board at American university medical centers. And the most important result you can see is that not a single one is at 100%. You could take this audit and feedback and you could use it for the hospital. You could split the hospital into divisions, departments, groups. You could look at it across Germany. It's audit and feedback that should be made available to people to see how they're doing and how they can improve themselves. It's very simple. It's audit and feedback, and it's easily accessible and collectible data. Ben Goldacre also looked at switched outcomes over a 6-week period. He looked at the top journal impact factor general journals in the world, and he looked at reporting of primary outcomes. And what he found is, in the vast majority of cases, trialists did exceptionally bad. And you will see more about the COMPARE project in journals shortly. So again, you could think about doing this in Germany. You could think about doing this at BIH. Again, it's not limited to clinical trials. It could be related to preclinical trials as well. You could think about also looking at how to get around covertly switching primary outcomes by using a declaration of transparency, which the BMJ now has in force. You could ask researchers prior to submitting to any journal that they sign a declaration of transparency. This would reduce a covertly switching of outcomes. Here is an example of the crisis in reproducibility. Has been going on for some considerable time, and it has very practical implications. We see that the first 5 projects of the Cancer Reproducibility Project have recently been released. And we can see here that at least in, we can see here that the hazard ratio in this case is it's a high hazard ratio, means that it is suppressing tumor growth, which is from this particular study. And the original authors reported the hazard ratio of above 9, but under replication, the hazard ratio decreases. It is not having any positive effect on tumor growth. So these are not esoteric issues, these are real live problems. But we need to promote reproducibility. Perhaps reproducibility needs to become a chapter in every single person's PhD thesis, so that the next generation of scientists can get a real live sense of the issues of reproducibility. Now, Jeff Flyer indicated that we should think about reproducibility in terms of promotion and tenure. And I think Jeff Flyer, he should know. He was Dean of Medicine at Harvard for a decade. And he indicated ways that we could think about reproducibility in terms of the promotion and tenure. And I think we ought to be thinking about this quite broadly. We could think about promoting open science, data sharing. And when I say data sharing, I don't simply mean sharing of data. What I mean is sharing of data, code, materials, being very open about it. And we are starting to find evidence that actually data sharing is associated with increased citations. It helps researchers disseminate their work. That will be useful for deans. It will be useful for departmental heads. You want to disseminate the work coming from your institution. This is simply one example. There are many other examples. Digital Science have done a recent survey. They do an annual survey about sharing of information. And this slide's important because although people are interested in doing it, they find it difficult to do. And so if we want people to share data, we need to set up mechanisms that will actually facilitate it. We need to make sure that we knock down barriers to facilitate data sharing of any type. We need to think about incorporating open access into promotion and tenure. Here is a small university in the United States, and I wanted just to read you. This is now part of the promotion and tenure of faculty. That open access supports many of the university's institutional values, including civic engagement, collaboration, diversity, equity and inclusion, economic development. These are not traditionally important issues that universities think about, but they're emerging issues, and we ought to really think quite deeply about them. We could think about using reporting guidelines as part of tenure and promotion, or scientists using reporting guidelines as part of writing up their research. So here's an example of StatReviewer. Essentially, StatReviewer is machine reading, artificial intelligence, and the computer has read 60 or 70,000 reports of randomized trials. You can put a randomized trial report into the computer, and it will automatically spit out how compliant that report is with CONSORT, which is a reporting guideline for randomized trials. We could expand this considerably, but again, we don't need to wait to go to a journal. We could do this at an institutional level, and we could reward people for using these types of technology as part of tenure and promotion. So here's an example of StatReviewer providing a compliance score for a researcher. We could think about promoting an institute, perhaps BIH, or perhaps the Quest Center needs to be an open science institute. The Montreal Neurological Institute has become completely open science. Everything they have is shared. All of their scanning results, everything they do. And they have indicated they've had no difficulty in attracting scientists to come to an institution that is completely open science. So I think this is something else that we need to think about. This is where we perhaps want to go. And very recently, the G7 nations indicated that actually open science may be where we are going to go, and perhaps we need to think about it in terms of promotion and tenure for universities. So I think this is an important development that I think hopefully will be instituted soon. So Erin McKiernan, I think, put it very nicely. Should we really think about universities returning to old values, broadening the working definition of scholarship? Should that now include open access? Should it include sharing of information? Valuing public engagement? Should we really think about what the universities in the United States are starting to do, the example I gave? Should that be part of what we think about in terms of what a university should be and what it values? And universities have always been a force for positive social change. And shouldn't we incorporate all of these issues about registration, about transparency in terms of the future of universities? Of course, the practical issue is how would we pay for this? And I think the Human Genome Project is perhaps an example of a small investment, a 1% investment perhaps by publishers, funders, academic institutions. Perhaps they could do something similar by coming together and moving it forward. I think the status quo is no longer good, and we know that what we've tried before hasn't worked, so let's try something new. I will take the opportunity of my remaining minutes to think about or suggest where Quest might want to go. So one is Quest might want to think about adding a publications officer to the Quest team. We have a publications officer at our hospital. It is the hospital and our research institute is the second largest in Canada, and we run into many problems that I'm sure are similar over here. We have a number of scientists from trainees all the way through to very senior scientists publishing in fake journals. We have a number of problems of scientists not publishing results. So for example, at the Ottawa Hospital, when I looked at Trials Tracker, I sent a note to our scientific director and chief executive officer and said, Duncan, I think we can do better. This is not very good, and I think I have some suggestions of how we could do better, and they involve using a publications officer. In a short period of time, what we've done is we've improved. We're not perfect, and we have a ways to go, but we've improved. And I think that this is of great value to the leadership of our hospital to see that we have a mechanism in place that can help improve the hospital and improve how research is done. Recently, Victoria Stodden and colleagues published a very nice piece in terms of how could we enhance reproducibility. And it's a very important issue, and I don't disagree with anything that they've written. The issue is at the practical level, how will you do it? And I think in order to do that, you need to collaborate with behavioral economists. I don't know if they have behavioral economists in Germany, but they are very important people, implementation scientists and librarians. I think it's very, very important. They are people who study behavior change. And if you want to change people's behavior, I think you need to collaborate with them. And so I think, for example, how to get what this team are saying into practice will require you having a bunch of behavioral scientists to make it happen. And you will need to monitor it, and you will need to provide audit and feedback to see if there's any change. I think you also have an opportunity to experiment with CVs to reward best publication practices. So for example, you could supplement a standard CV and ask each person against each particular product that they have to supply registration information about the study. Again, it doesn't need to be clinical, it can be preclinical. You could ask them to indicate have they used a reporting guideline for reporting their research. All of these pieces of information could be used to experiment and supplement at the institute level. And you could experiment. Maybe some divisions or departments might be more eager than others. You could see whether it produces better results. So I think you could see this positively. So here's an example of a young scientist. You can go onto the web and find many promotion and tenure packages of scientists. And here's one young scientist that has put a number of different characteristics that we traditionally don't think about, but maybe they're really important. Maybe we ought to think about these and see whether they improve the situation that we have. We could also think about using an editorial-like management system. So for example, if you want to publish in BMJ, F1000, you have to use a particular system. And if you don't want to use it, you can't submit there. But maybe departments, universities, institutes could think about using a similar mechanism for promotion and tenure. If you want to be considered for promotion and tenure, you need to use these CVs and you need to supplement all of this information. And you need to obviously work collaboratively to make sure that these aren't barriers for people, but they actually to knock the barriers down and to facilitate their use. So that's very, very important. You may want to ask the Institute to recommend that all trainees complete training of peer review as a formal part of their degree requirements. For example, Publon's Academy is online. It has 10 modules. It's free of charge. See, does it work? You can only get better than the current system. Our current system is very bad, and anything we try is only likely to make it a little bit better. You could think about this example again. You don't have to go by medical schools. You could think about using this by divisions, by departments. If for trainees, are they providing better peer reviews? Are they gaining greater insight into peer review? You could think about rewarding badges for departments and people for actually using certain characteristics to promote their CV, to promote better behavior. This is simply an example of using badges to promote transparency, but you don't have to think about it in terms of a journal. You can think about it in terms of the people within an academic institution. And I'll close here with some other ideas and thoughts that you could think about in terms of how Quest could move things forward. One is you could mandate ORCID throughout the Institute. Our institution is doing that. You could ask BIH, the hospital, I don't know how it's set up, but you could ask them to sign DORA. You could ask them, if they don't want to sign DORA, to sign the Leiden Manifesto. It sends a strong signal of what you think as an institution, not only for current scientists, but for the future generations of scientists. You could ask BIH to become an open science institute, just like the Montreal Neurological Institute. You could include patients and the public in the center's activities. You could identify the Institute's promotion and tenure criteria. What are they? Are they evidence-based? And you could teach courses about the publication sciences. I think one of the successes that we've had in Ottawa is that every single week we teach a course, somewhere, to some department, to some division, to some group. And over time, those barriers are dropping to seeing us as a nuisance, to seeing us as something value-added, helpful. And I was last week with the scientific director of our institute and the CEO of our hospital. They see value in what we do. And maybe they're just saying that because I'm sitting with them, but they have no reason to compliment me whatsoever. I think you might also want to think about awarding a prize to the group, division, department for good scientific behavior. The way to do that is provide audit and feedback, just the same way as Ben Goldacre is able to do it. Everybody can do it. It's easily collectible information, just as easy as collecting the useless information of journal impact factor. So, thank you very much.
If there are any questions, ask them.
Yes, so much of the problems we're experiencing are probably because of tough competition between scientists. So I wonder what you think about whether we should reduce the numbers of PhD students and the PhDs awarded, or postdocs maybe, at what level, and how should we do that, if you think so?
Oh, that's a tricky question, and to be honest, I don't feel I know enough about the situation to be able to comment on that, certainly in Germany. I would say in Canada we produce more than we need. Part of the problem of that is in Canada, and again I don't know how it's set up in Germany, in Canada universities are given money by the government for students. And so it becomes a bit of a vicious cycle, that universities are becoming much bigger in terms of population, of numbers, because they're getting lots more money. I don't know what the job market is like. I think it is competitive. Is it more competitive compared to, 15 years ago? I don't know. I do know that the recent one of the recent 2017 Nobel laureate for medicine indicated that when he finished his postdoc, he got a job without a single publication. That does not happen in 2017. Whether that's a good thing or not, I don't know. But we need to move away from numbers to thinking of other things. I probably haven't answered your question sufficiently, but I don't know enough about... I'm not high enough in administration to understand issues around new students, competition in terms of jobs.
So I'm an MD student, and I just recently started my thesis project, and I feel like that my working group is doing the research like you described in the old way. And my question is, what can I say to my supervisor, or what can I show him that he starts thinking about doing it in a better way?
Sure, that's a great question. I think you obviously have to be diplomatic, and you have to start slow. You can't change the world, and you need to finish your studies. One immediate suggestion would be to ask your supervisor, presumably you have lab rounds, whether you could have a session on some of the topics that we've discussed in terms of open science, data sharing, registration, and you could give examples of what other people are doing. I think that is probably one way to begin. You may have opportunities if you were within a department to have an invited speaker. You could have Uli come and give a talk about the benefits. We need very practical benefits of behaving in a better way.
Speak up without microphone. So thank you for a very good talk. So my question goes about behavioral changes connected to reproducibility. So I would argue that reproducibility problem is coming from the incentives that the system has put, and not from the philosophy of the scientist that somebody deliberately fakes the data or runs into the problem of reproducibility. So I would argue that if the incentives would be different, the behavioral economics shouldn't have happened at all. So what is your take on that?
I don't wish to imply that actually research that cannot be reproduced, that there is something sort of fundamentally wrong with the original researchers. I think there's a spectrum of cases. So I don't know how many of you are familiar with Anne Cuddy, who's a social psychologist who in 2010 became famous because she did a study on what we call power poses. You pose in a certain way, and she showed data in a social psychological experiment that actually people who did these power poses were more successful. She had a TED Talk. The TED Talk is the most downloaded TED Talk, 43 million times. Then people started to see, could they reproduce her research? And they couldn't. Now, there are many aspects of that that I don't want to talk about because it's a complex issue. But I think that we ought to think about reproducibility as part of the generation of science. And we ought to think about actually collaborating with the original researchers, working with them as part of any reproducibility. And I think we need to integrate reproducibility as part of the sort of scientific package. And I think an example of that is, again, I'm not sure how many of you are familiar with Brian Nosak, who is a social psychologist who showed, I don't know if it's last year or the year before, that 100 psychological experiments, when he worked with the original authors, that actually their effect size, their delta, they could only get it in about 38, 39% of the trials. So there are many reasons for this. So I think it's a complex issue, but I think we shouldn't think about reproducibility as, you know, I'm going to go after that person and they're wrong, and it shouldn't be that. Maybe in a few cases there is some issue, but in the vast majority of cases we need to sort out, is it the reagent that was used? Is something wrong with the methodology? We need to work with people to sort that problem out.
Thanks very much for this talk. I would like to go back to the Nobel laureate. I think it was a Swiss countryman of mine who got the job without a publication, and reminding us that science is much more than first author publications, which is really the only thing that we can count at the moment, because we don't really know what the third author has done. There is no good metrics to do that. And science is about discussing, bringing in ideas, being vocal, and communicating, criticizing, reviewing grants, reviewing papers, but even in journal clubs, making good suggestions to papers that have been published. Now, this could all be used in the old times for this Nobel laureate. The people knew him, you know, it was a small community. Now the community is much bigger, but we have big data, we have social networks that have gone far beyond what we do in publications. So if we encourage our universities to give students an identity, be it an ORCID identity or so on, that they can use from the very earliest stage as a bachelor student to comment on papers, to tweet, all should get the young medical students should get a Twitter account, that's my suggestion, and comment and really discourse science. We can analyze the quality of these tweets, the quality of these journal reviews, etc. So we can go back to sort of having science as a more sort of multifaceted things. And then in the end, I would also include teaching in this, which we can also assess now more accurately. But we really have to go back from this sort of single metrics of just first author publications.
I don't disagree with you, but I think what a good question to ask, I was asked by the faculty, the office of the dean, to come and talk to them about how should we think about incentives and rewards. And I had only one question to ask them. What are the values? What are your values? What do you value? And they looked at me like I had two heads. But this is what promotion and tenure should be about, value. But I would say, I would, if I could, with respect, disagree with you about first authorship. There are mechanisms in place that Quest can educate everybody about. There's something called credit. And credit is actually giving every person in a paper what was their contribution. And that credit can be used in ORCID. It now can be used in many different ways. So credit is a system, and I can send you some papers about it, but it is very much a way for the third author to say, actually, I may be the third author, but you know what? I cleaned the data set to make sure it works. I did a double check on it. I ran some descriptive statistics to make sure it works. Or I was in the lab and I took care of the mice for some experiment. Those things can go in the credit system, and I would I mean, this is part of what we teach every week. The first author is by no means panacea. It's highly complicated. And I will say that what's very interesting for our publications officer is kept the two busiest things she's kept busy doing. One is dealing with authorship disputes. And the second issue is people publishing in fake journals. And we are a large institute.
So, hello. So I'm going to pick up on the comment just now, and I'm going to be vocal, and I'm going to go back to return of interest, which you started out with in your nice lecture. And what I'm a little bit surprised about, or which I'd be sort of interested in seeing possibly, is for the translation, how guideline relevant is the research, or are there patents? Because those are the two measures I can think of that are really showing me that the research we're doing is coming to the patients. So maybe you'd comment on that. And sorry, I'm going to ask a second question. It's very short, though. Is there any way to measure the way we're designing the trials that they're going to be valuable? So before we actually have the data, so that the researcher feels more comfortable maybe publishing or talking about what he has instead of hiding a mistake. So 2 questions.
So I think the patent story is a good story, and it may be that's the story of BIH, that's what they value. That's fine. If we use the example of the Montreal Neurological Institute, which is not focused on drug therapy, I will have to preface that, but they've gone completely open science. Patents is not something they're concerned about. They are not going to help people patent their work. And they still have been able to attract people. So that is the value of the Montreal Neurological Institute. If you value patents here, if that's part of your value system, then you need to incorporate it into how you think about dissemination of research and its role in promotion, tenure, and hiring. So I think that's...
I want to measure translation, so guidelines which are not receiving patents. So how do we measure translation to the patient, return of investment?
You have to see that if you have, 100 preclinical molecules, how many of them make it to the bedside, and maybe that's one measure to look at. I think again that's probably an internal discussion that may change. In terms of helping people design experiments so that they're designed better, I think I will just give you an example in the clinical world. So there is something called SPIRIT, which is it's a guidance for developing clinical trial protocols. So people ought to get educated about that. What is SPIRIT? How can they use SPIRIT? And that could be used, again, in the preclinical world. It does require an enormous amount of education. Lots of scientists are wonderful people. This is a fast-changing world. They simply don't know about a lot of things that are going on. They don't know about SPIRIT. They don't know about credit. They don't know about open access. They don't know about sharing of data. There's lots of things they don't know about. So we must go out there and teach them, share this with them, get them on our side. I think also we need to really remind people that none of us do perfect work, that making mistakes is fine. We need to be honest and open about it. The problem with switched outcomes is not that people switch outcomes. It's quite possible that when you're doing a study, something has happened and you need to change it. Be transparent. Say that. Don't be covert about it. So I think that we need to educate people about those sorts of things.
Hi. You were excluding the journal strategical start as a possibility to apply a level. but if we actually create a journal for repeated experiments, where you can publish experiments that fail or experiments that work, and you open up the peer review process, don't you think that maybe that could help as well?
It's entirely possible. I mean, I don't know that I see a role for journals. I don't know whether journals will exist in 10 years' time. There are many mechanisms in place for you to focus on reproducibility. So, for example, the Open Science Framework is a repository that you could go and put your work in. You could have a reproducibility area within the Open Science Framework. I would imagine the BIH or the university has a repository. You could go and put your work in there. You could let people know that there's a group of you interested in reproducibility, and you could go and put it there. There's no reason for you not to share information about reproducibility and get colleagues to come on board and make all of that information available. You don't have to have a journal. Because I think, unfortunately, I am a journal editor, and I'm not too pleased with what journal editors are doing. That's a tremendous generalization. But I think that we have not succeeded in improving the situation.
Two more questions and then Ryan.
First of all, thanks for your amazing talk. The lady you mentioned who gave that extremely popular TED Talk reminded me of another issue I see in this context, namely the fact that some people, some researchers might have other motivations apart from maybe getting some kind of job or tenure or stuff like that. They might, or maybe they even have tenure already. Imagine a person who's hoping to become popular, write maybe a popular science book, maybe have a TED Talk at some point. And so there is money and also, of course, other things, fame in them for selling a certain narrative. Of course, we can't stop people from watching certain TED Talks or buying popular science books. So from inside the science community, what could we do to also kind of undercut the mechanisms that make people, researchers, produce and sell certain narratives by bad practice?
Well, I think, first of all, what I think the research community has to be is transparent. And I think, in general, we're not as transparent as we should be. I think that the Anne Cuddy story is interesting from certain perspectives, that there are some scientists who I think, in a very transparent way, try to show that actually they could not reproduce her research. They tried to do it in a very authentic, legitimate way. There are other people who were, in my opinion, extremely negative about her as a human being. And I think that is hugely problematic. Stick to the research project, stick to the issues that they were not able to reproduce, and stick to the methodological problems that they uncovered. Don't character assassinate people. We need to show some dignity because none of us are perfect. We all have issues that we need to be aware of. So I think it's a balance, but I think we need to train people early on that they need to stick to the issues and not go after humans.
You briefly mentioned registered reports, and I'm aware of their use in psychology, my home discipline. So I think about 50 journals have signed up for this program where peer review happens for introductions and methods before results are collected. Is there much uptake of this in medicine, and are legal guidelines starting to reflect this, given that registries such as clinicaltrials.gov haven't really achieved the desired aim? Also, her name is Amy Cuddy. I feel, as a psychologist, I should correct you.
Sure. What did I call her?
Anne Cuddy.
Anne. I got the A right. Okay, so thank you for that correction. That's an important correction. Registered reports were started in psychology, and they are slowly making their way into medicine. I'm aware of one Biomed Central journal having registered reports. I think medical journals are, how shall I say, conservative. And so innovation takes time. What I think we need to do, and I probably haven't emphasized it enough this evening, is we need to experiment the whole time. So we have all of these psychological journals that have used registered reports. And I want to know, is it effective? Is it actually having the intended effect or not? That I don't know. We need to experiment. The same way as the TOP, which is the transparency and open guidance for journals to use. I was in Charlottesville recently because we're working on TOP 2.0. We don't know whether it works, and we need to integrate an evaluation into that. So I think registered reports are perhaps useful. Let's investigate to see if they're effective.